Hi, my name is Jessica LaGrand, and I am a community health worker at Bronson, and I work for the Bronson Cancer Care Equity Team. In this segment, I'm going to talk about prostate and testicular cancer. These two cancers are one of the two cancers that are affecting our male population, especially in our underserved communities. So most prostate cancers are found early through early cancer screenings. And I can't mention this enough about having a primary care doctor who can set those screenings up for you. In this segment, I'm going to talk about colon or colorectal cancer. It's important to know that colorectal cancer is the third most commonly diagnosed cancer among both male and females in the United States. And when we talk about colon or colorectal cancer, what we're talking about is where it starts, and that's generally starting in the rectum or the colon. These cancers can also be called colon or rectal cancer, depending on where they start. Colon and rectal cancer are quite often grouped together because they have some of the same common features. On the screen, we're going to put an image up showing you a picture of what a normal colon would look like. A colon that has not been, does not have any polyps. When we talk about polyps, we're talking about a growth. It can be a small growth, as small as a dime, or a larger growth as big as a lemon. And that's important to keep in mind as you look at these images. The next image is actually going to show you a picture of a colon where the polyps have grown onto the colon, and this is where there's going to be area for concern. So please make sure that you are getting your colon cancer screenings regularly. Some of the symptoms that you may have if you're experiencing colon issues would be a change in bowel habits, and that would be where you're either finding blood in your stool. It could either be bright red or very dark. You also may be experiencing diarrhea or constipation, or have a feeling that you haven't completely emptied out your bowels. Another symptom would be if your stool sample is narrower than normal, as well as just losing weight for no reason. You're just losing weight. Exhaustion, feeling very tired, vomiting, or anemia with a low red blood count cell. Recently, with colon cancer, one of the things that's also important to know is that there are and will be, and this is from 2017, so the data is not quite up to date, but it's stating that 1 out of every 10 people diagnosed will be under the age of 50. So that's another message that I want to get across today, is that you don't have to wait until the recommended age of 45 to be diagnosed or to do a colon cancer screening, especially if you know there's a history in your family of colon cancer. The other thing that's important is to know your body. If you have felt any of these changes that I spoke about, the symptoms, you're tired, you're vomiting, you have diarrhea or constipation, these are things that are important that your next step would need to be contacting your primary care physician.